Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. So today I want to present about the wheelchair course for the scientific paper presentation. Before that, introduce myself. My name is Ali Tam Saifuddin. So for the first is table of content. The first, title of article. The second is correlation in prosthetic and orthotic, purpose of the study, and then material and method, result, and the last, conclusion. So for the titles, use of an upright power wheelchair in spinal cord injury, case series. So correlation in PNO. This study directly relates to prosthetic and orthotic and assistive technology because the first investigates the use of a standing power wheelchair as an orthotic assistive system for individual with spinal cord injury. The second, explore how the upright mobility design affect biomechanics, posture control, and independence and quality of life. Contribute to PNO practice by evaluating a device that enhance mobility, functional reach, participation in daily activity among non-ambulatory users. And so the purpose of the study to evaluate the safety, independence, usability, and quality of life in individual with chronic spinal cord injury or SCI who use a standing power wheelchair over the periods. So the material and method, the participants for the any 4, 3 male and 1 female with chronic SCI, duration 3 until 13 1, including criteria. It's for the criteria, the 18 and until primary wheelchair use height 160 until 190 centimeter, weight less than 100 kilogram. So exclusion criteria, active pressure ulcer, severe spasticity, height fracture risk, and cognitive impairment in the last pregnancy. So the study design, case series or pilot study with pre-post single group open label design, conducted at the James G. Peter VA Medical Center. Intervention 3 sessions or week. It's about 3.5 hours for the material and method. The first is the device. For the device, standing power wheelchair capable of sitting, standing, and overground mobility. So the second, control via joystick and computer assist stabilization module. For the procedure, the first, initial fitting and training on the transverse control and position function. The second, training session, use taught at least 5 minutes every 15 minutes as tolerated. The third is monitoring blood pressure or BP, heart rate or HR, time in standing or sitting, comfort scale, use 1 until 5. The second is activities for the indoor and outdoor navigation, relaxing tasks, and self-care, social interaction. So for the outcome measure, the first is safety, blood pressure or BP, heart rate or HR monitoring, adverse event reporting. For the usability, modified wheelchair skill test or WST, sit to stand, stand to sit, and mobility tests. For the quality of life, for the SCI, quality of life is the domain bowel and bladder management, preference, and behavior. Use satisfaction 5-point, like scale on comfort, stability, and usability. For the data analysis, descriptive statistic participant, pre and post comparison of psychological response and quality of life scores. For the purpose of study, the research design case series for the number of participants, 5 individual with chronic SCI for the complete to the study, and device up and right electric wheelchair with sit stand functional. For the duration, 3 sessions per week. Parameter measure blood pressure, heart rate, standing tolerance, and mobility and quality of life. And then data analyze, descriptive pre-post comparison, and subjective use assessment. For the result, there were no serious adverse events. Participants were able to stand safely and stability, and improve mobility and functional activity, improve SCI quality of life scores, bladder and bowel, and pain function, high user satisfaction, good until very good. For the challenges, transfer and early adaptation to use. For the conclusion, upright power wheelchair are safe and tolerable in individual with chronic SCI to improve posture function, social participants, and comfort compared to conventional seat wheelchair. Further research with a large sample size is need to assess the long-term health benefit. For the results, for the safety and stability and quality of life, for the SCI and user satisfaction, performance. That's the conclusion. The upright, up and right standing power wheelchair was safe, visible, and effective for individuals with chronic non-ambulatory SCI. Participants demonstrate improved orthotic tolerance, mobility independence, and satisfaction with upright posture. The study support further research with large sample size and longer use period to determine long-term benefit for bowel and bladder function, pain, and overall quality of life. So for the presentation, I think is enough. So happy watching for the video. Thank you.